three-week-long limbo. The House elected Congressman Mike Johnson as their speaker. Their plan was to move appropriations legislation to floor votes, including this proposed supplemental appropriations bill. And now the countdown is extremely tight, as the funding will run out a week from today. They must pass these 12 funding bills to extend the current funding through a continuing resolution, or we have a government shutdown. So prior to his election, Speaker Johnson had released a roadmap. We'll share these slides with you so you'll be able to access this link that indicated that the preferred method that the House Republicans wanted to pass these bills was 12 appropriation spending bills rather than one big tax bill. So they brought last week, they had the THUD funding bill to the floor with many amendments, and many of these amendments would include further cuts to issues that are dear to us, key housing and community development programs, including the Housing Choice Voucher program. But perhaps due to the lack of consensus among the House Republicans and these harsh amendments, the bill was actually yanked from the floor yesterday, and there's no current timeline for that bill. Even if there had been consensus, it was pretty unlikely that the administration and the Senate would have been able to pass that bill. Over on the Senate, the bipartisanship, relatively speaking, to the House continues in that they want to stick to the spending limits that were agreed to. So both of them are going to be pivoting to consider a supplemental appropriations bill, which will likely take the form of this continuing resolution. And the House supplemental bill only includes one small part of the administration's $1 billion request, which has some pretty difficult things in it right now. Israel, funding for Israel, the disaster relief, Ukraine aid, and humanitarian aid. Senate is also working on a proposal that includes most of the administration's request and aid for childcare. Okay, what do we want to say about that? It doesn't look, one last word about the budget, it doesn't look like Speaker Johnson's initial ambition to have 12 funding bills is going to be possible, given that the clock has run down so close to the wire. Okay. So over to the Affordable Housing Credit Improvement Act of 2023. We have the bill numbers there. And again, we will distribute this for folks with the links in case they want to dig in a little bit more. The incremental, more folks keep signing on, even if it is only 4 here, 2 there. So the Senate is now up to 30 co-sponsors, 2 additional ones from last month, and the House picked up 6 additional, up for that's 172. And what was I going to say? This is actually considered to be the most bipartisan bill in Congress at the moment, which is great. And it has to do with the strategy that the Action campaign has adopted, which is introducing sponsors in pairs, and they're going to stick with that. What else can I tell you about that? There are some key folks who have not weighed in on on it because of their position in Congress. So even though chairman of the House Ways and Means Committee, Jason Smith, is a big supporter of the legislation, he can't because he's the chair, and also the ranking, I think it's Richard Richard Neal is in a similar position. So there are those are some key champions who are not accounted for here, but who will be really critical behind the scenes. So obviously the clock is ticking for the fiscal year 24 spending and tax bill. It's going to be critical. The advocates are telling us to include the housing credit in any tax package. So all of us as advocates and our members of Congress who are co-sponsors now must push a little bit harder to continue to build the co-sponsorship. It helps the congressional leaders and the tax writers to see how important and how broad the support is for the bill. So what the Action Campaign actually just sent out an email blast about this. What they were saying is that at this point, it would be helpful if all of us could do a big push to thank co-sponsors for being, champions of the bill, and to urge them to be in touch with their Senate and House leadership, and also the members of the House Ways and Means Committee and Senate Finance. So if you happen to know if your member of Congress is a member of those two committees, that's a priority. Okay. But the other piece about that is the timing, of course. The reason why it's so critical is because this is probably the quote unquote last best chance before we head into an election year. If it doesn't happen now, it's not as likely to happen. Okay, so with that, this is pretty much the slide that goes with that. And all right, we'll go to updates about home. It's the same update, which is that the Senate had approved this very drastic cut. But I'm sorry, the House had approved it, but the Senate was wanting to keep the funding flat. Home is critical because it is also used as gap funding for LIHTC programs, as well as for other other projects as a participating jurisdiction may deem necessary. So it's both critical in production of housing and in preservation as well. So same thing, if you're already have an ask about AHCIA, add the home program as well. We'll just have a quick workforce development update. There are a couple of two new sponsors, I believe, from Alaska, actually. Murkowski and gosh, what's the other guy's name? Hold on just a second here.
Sullivan, maybe the senator?
Is it the senator? Let's see. Sarah's trying to help me out. It is Sullivan. Yeah, so it is both of the Alaska senators. Thank you so much. And with that, I will turn it over to Sarah from NASDO, who will give us the updates. Okay, Sarah, are you able to call up I'm going to stop sharing so that you can share your slides.
Yes, thanks so much. I'm just pulling them up here. Okay, are you seeing my screen?
Yes, I am seeing it.
Okay, fabulous. Well, thank you so much for inviting me to be here today. It's a real pleasure to talk with you all. You're such leaders in the healthcare space, and the alliance that I run, the National Alliance to Impact the Social Determinants of Health, is really aligned with a lot of the work that HAN does. So I have come to this meeting before about a year ago, and it's great to be invited back. I really appreciate it. So again, my name is Sarah Singleton, and I work at a firm called Levitt Partners that advises individual clients and also runs multi-sector alliances. We were founded by former Utah Governor and HHS Secretary Mike Levitt after he left his government service, and he wanted to continue on the course of trying to improve healthcare. So he founded Levitt Partners to keep doing that work. I've been with Levitt Partners and the NASDO team for almost 4 years now. A little bit of background. Oh, I meant to go into presenter mode. I'm sorry about that. Let me do that real quick here. So what I wanted to do today is share a little bit about recent SDOH policy activity that's happening on the Hill, share a bit about what is happening in the administration, and then inform you all about what NASDO as a coalition has been up to, and also some upcoming NASDO activities that we'd love to have any of you engaged in. So this slide, I'm sorry, it occurred to me right as I was about to present. Oh my gosh, I should have told them, made a slide of who our members are. So I made this real quick. I forgot to capitalize the word members because I was doing it in 30 seconds before here. But you can see on the slide here, our NASDO steering committee members and general members and strategic partners. We have within here a number of healthcare organizations, providers and payers, and some who play both of those roles. We have health and social service organizations, tech partners, business, public health, consumers, and some are sort of in an other category. And everybody comes to NASDO because they're united in the viewpoint that addressing individuals' social needs and also the upstream drivers of those needs, the social determinants of health, should be part of how we pay for and deliver healthcare, and that there's an important role for all of those different sectors that I talked about that are in our membership in that ecosystem. So just a little bit about NASDO for any of you who have not heard of us. I hope some of you have, but if not, I encourage you to visit our website. It's NASDOH.org, NASDO.org, and you can see there our work. So to jump into the agenda, first to talk a little bit about Capitol Hill. So I know it sounds like you all follow a bit of what's happening on the Hill on the housing front. From the NASDO perspective, we take a look and do a lot of legislative tracking and also outreach ourselves to members of Congress and their staff. And sort of, there's a couple of dynamics going on right now. One is, I think that there's been a real, much broader awareness of the role of social determinants of health in healthcare quality and outcomes that we're seeing. So when NASDO was started over 5 years ago, a lot of the meetings we were doing on the Hill were sort of social determinants of health 101, educating, maybe sharing that term for the first time with people and trying to explain the impact of social determinants of health on healthcare. We don't have to do those kinds of meetings anymore. People are quite aware of what social determinants of health are, and on a bipartisan basis are interested, at least in the social needs part of it, I would say, in helping individuals with, the transportation or food or housing that are impacting their ability to seek care. One notable thing, though, is that the terminology that sort of resonates has changed, particularly over the last year. So NASDO was founded by Mike Levitt, former HHS secretary under a Republican president, and Karen DeSalvo, who's now at Google Health, but was previously the acting assistant secretary for health in the Obama administration. So a Democrat and a Republican, that's sort of emblematic of who we are. And the term social determinants of health at the time was sort of considered a neutral term that could be used to describe, what we know now as SDOH. I would say the pendulum has shifted a little bit. So as we'll get into on the next slide, when we talk about the administration, the Biden administration, even in the campaign phase, really adopted the terminology of equity beyond just health equity in lots of different ways, but health equity was certainly a big piece of that. And we know that social determinants of health and health equity, they're not one and the same, but you can't get to equity without addressing social determinants of health. So in those circles, I'm speaking very broad brush here. And of course, this isn't going to be, true in all respects. And in broad brush, the Democrats have embraced that Biden terminology and ethos towards equity. At the same time, on the Hill, in the Republican circles, there's been sort of a bit of a turnoff, I would say, to the term equity and also to social determinants of health. So we've seen terms like health-related social needs, which is the terminology generally used in the Medicaid program, as well as non-medical drivers of health, NMDOH. It takes me a moment to say it because it does not roll off your tongue easily. Is resonating more. I think, part of that is sort of the connection to the health. So you're relating the social need to the health very clearly in the name. And also sort of just a bit of differentiating on the political side. So as an example, I have here on the list of legislation, there were provisions in the Prevent Pandemics Act, which was a bipartisan bill that came out of the Senate Help Committee last year that was rolled into the omnibus spending bill and passed last December. And within that, there was an SDOH related program authorized, and the language of the program stayed exactly the same between the committee passed version and what finally made it into law, but the terminology on it changed and they took out the SDOH terminology from it. So I think to me that sort of captures where we are, that on a policy basis, there isn't so much disagreement, but the messaging around it really matters. I also have this list here of legislation. I certainly am not going to go through all the different SDOH related bills. It is notable, though, that when NASDO first started, there was really only 1 or 2 bills on the Hill that were SDOH related. And now this is just a sampler here of legislation. There's a bunch of things that have SDOH right in the title, and all the ones marked with an asterisk are ones that are bipartisan bills. So you'll see most of those are bipartisan bills. And there's things around the data and technology to link different providers in the system. There's CDC grant programs. There's the Caring for Social Determinants Act would require the CMS administrator to issue guidance to states about addressing social needs. And then, as the last bullet mentions, there's lots of mentions of SDOH in bills on food, transportation, veterans, rural community development. All those bills sort of outside of the healthcare space are beginning to use the framing of SDOH. So I think that the overall message I want to convey here is that the interest in this topic has grown and grown, and it remains bipartisan, but the language that we use these days has to be chosen a little bit more carefully to resonate. To move on to the administration. As I mentioned, this has been sort of before even Biden was elected, and then continuing through his presidency, a real priority on equity. And it started with, a first day of office executive order on equity with direction down to the federal agencies to try to implement that, and then getting down even deeper into sort of the operations and different programming and budget priorities of different departments and also the sub-agencies. So just a sampler here of some of those things. I'm guessing that many of you saw, it was a little over a year ago that there was the White House Hunger, Nutrition, and Health Conference, and the administration has sort of kept up the follow-up from that. And this was the first time in 50 years that the White House had a hunger conference, and they added in nutrition and health and really made health a big piece of that. And the interest in food as medicine programs, I think, was already there before, but this, in my mind, really made it launch. And it feels like every day there's some sort of new announcement about partnerships and research and exploration there. In addition, there has been rumored for a long time that there is going to be some kind of SDOH action plan coming out of the administration. It was anticipated in the earlier part of the year. Here we are, and the year is almost done. It's not out yet, so I'm no longer making guesses on when that's coming out. But I know it's been written. I've talked with lots of folks. I know that there is something brewing there. It's just, I think, a matter of sort of how that gets prioritized and rolled out, since it is a White House level document. There's also examples of the administration sort of trying to work together across departments. So of interest to you all, and I'm not sure if you all have followed this, there's an HHS and Housing and Urban Development partnership on housing services and resource center. That's just one example of the ways in which they're trying to sort of put out information. I've seen, things, this is a little bit less SDOH related, but, looking at sort of school mental health as an example of, memos and guidance coming out from Ed and HHS and other departments. So I think they're trying to, it's a real bear. I've worked in the administration myself. It's a really hard to coordinate even within your own little silo, and never mind across silos, but I think they're trying to do that on these issues of equity and SDOH. And then finally, within HHS, there's just been tons of different kinds of ways to try to move the needle. None of these is the one cure-all for SDOH by any means. But you've seen from CMS so many 1115 waivers that are incorporating health-related social needs. Earlier this year, the guidance on in lieu of services, which is a way that states can, in lieu of providing health services, provide other kinds of services. And the things they're really talking about there, many of them are related to meeting people's social needs. And then, a real shift in the Center for Medicare and Medicaid Innovations, their demonstration programs to focus on health-related social needs, which makes sense. I think you're probably all bought into the idea that if you're going to try to really see the outcomes that you want out of healthcare, you can't do that without addressing health-related social needs. The Administration for Community Living and Centers for Disease Control are collaborating on this new program called Community Care Hubs that's trying to bring together community-based organizations and provide infrastructure for that really sets them up to partner with healthcare. CDC has put out a couple of different grant announcements. They haven't gotten all the funding that they have requested in their budget. So this has not gone as big as they want to, but they're trying to move the needle through sort of the public health lens on addressing community-wide needs. And then finally, NIH recently put out the first round of awards in its COMPASS program, which is something being run out of the Common Fund, and trying to look, it's unique because NIH generally awards funds to sort of your typical academic research institution. And here they're having CBOs be the leads and trying to look at community factors that impact health, and issuing 10-year-long grants to really get at some of those systemic issues. So it's quite a change in approach for NIH, and will be really interesting to see how that develops. Just finally here on NASDO activity. So what we've been up to this year is there's been so many different CMS payment rules. So we've been commenting on all of those as they relate to quality measures or other requirements related to equity and addressing social needs. There's also been a lot of, it's a time when Congress hasn't been legislating as much, but kind of a year to gather information. So there's been lots of requests for information from new committee leadership. So we've been responding to lots of those on a variety of different topics. We put out this spring an issue brief on SDOH progress over the last 5 years. I sort of mentioned some of the thoughts that we included in that as I was talking about how it's changed, coincides with the NASDO 5-year anniversary, but also sort of a chance to look back at what's happened and a vision, putting out a vision for what we hope will happen in the future. And then lots of just talking with the Hill and the administration as part of doing our work. There's a couple things that are upcoming that I wanted to highlight for you because there's opportunities for you all to get engaged if you wish. NASDO is a membership organization, so we have our own members and do things internally, but we love to partner where we can, and these are both opportunities where partnership is not only possible but encouraged. First is on December 12th, we are having a stakeholder convening to discuss social needs screening measures. So I know Sandra shared with me that you all have had some discussion in the previous months in this group about the different ways between, CMS's quality measures, the accreditation measures, the National Committee for Quality Assurance's Health Equity Plus accreditation. There's all these different screening requirements that are sort of out there. And there's a lot of organizations that are supportive of those, but also feeling like, whoa, this is a lot coming. Like, I wonder if there are ways that this could be done in a way that maximizes the ability to kind of harmonize between these different systems. And so that's what we're gathering folks to talk about. We're having our own internal NASDO members, and we've also invited a number of external organizations. Some of those are associations and some are individual, hospital systems or insurance plans. If any of you have an interest in participating in that, we would love to have you there. So I'm sure Sandra can share my contact information. I can put it in the chat too. Please reach out to me. We'd love to have you be part of that conversation. And our goal with that is to come up with to sort of see where there's consensus amongst the stakeholder community and be able to convey some of that to CMS as they think about next steps in all of these. So we're really hoping it has some action oriented to it. The last thing I wanted to highlight is an opportunity for technical assistance. So NASDO received a grant from the Robert Wood Johnson Foundation to develop a framework for the healthcare system's role in advancing equity. And actually, some of the folks that are on the line here, your organizations were featured in this project called Raising the Bar. We have some additional funding from the foundation to do a technical assistance program. So we have an open application, a letter of interest, and we're going to select 5 healthcare institutions to receive the ability to have TA one-on-one coaches from Health Management Associates, which is the parent company that my company is part of. HMA folks have been Medicaid directors, worked in hospital systems. They're people who've sort of stood in your shoes before, and most of the time are charging clients to do this kind of TA work. And this opportunity, we get to actually give this out to some institutions that want to work on advancing their equity goals, big or small. There's a lot of flexibility here for what kinds of projects they want to take on. The Raising the Bar framework outlined 4 roles for the healthcare system as provider of whole person care, as the employer of a diverse and inclusive workforce, as a partner in the community, and as an institution that can invest in its community. And so the projects can be in any of those different role areas. It may be that you haven't gotten started and you want some assistance in getting sort of your equity program up and running, or it could be that you are, well underway, but you're facing barriers in some area, and the HMA coaches will sort of help you work through that. So I'll have here, I think you guys will Han will share these slides afterwards. There's a link here, and you can also email me. The letters of interest are due by November 29th. And we've really taken an effort to make it pretty easy to apply. This isn't something where you're going to spend 50 hours doing the application. It's pretty streamlined. So you can just give us, some information about who in your organization would participate and what your goals are, and then we'll be selecting those 5 institutions to participate in the opportunity. So I think that's the end of my slides.
Just really quickly, Sarah, can you tell folks what the best way is to register for the convening on the 12th? Is it just an email intro? What would work?
I have a registration link. So do you mind if I send it to you as a follow-up, and then people can from there register on the link? They can also just email me and then I'll register them. But we do actually have a official registration link.
Share it with us and we'll push that out to folks.
That'd be fabulous.
And I got one person in the chat who said they would be interested. So if anybody else knows that they are interested, let us know, and we'll make sure to reach out to you with that link.
Wonderful.
So this is a great moment for folks to ask Sarah, who obviously has an incredible breadth of knowledge on these issues, any questions they might have. And feel free to drop things in the chat if someone else is already speaking. And I'll make sure that Sarah sees that too.
Sandra, I have a question, comment, and a question. First, I'm actually glad you exist as someone who's been paying attention. I regret that I have not stumbled across your work or haven't spent a lot of time looking at it, I should say. I think I have heard this group referenced before. But I'm glad Han is seeing this as part of our developing our policy agenda, right? That it's not just a list of bills, it's really this overall movement that's going on. So those are my 2 comments. My question really is that when I see a list of more, I'll just say SDOH related bills, it is encouraging policy initiatives, executive branch as well. One of my concerns, however, is that it is hodgepodge, right? It's a little bit everywhere, and it's everyone trying to do something. So along comes like raising the bar. That is a document that I have seen and read. And to me, I think part of our message has to be not just saying thank you, CMMI, for doing something, thank you, House Republicans, for doing this, or Senate Democrats, but really trying to see what if we were to codify raising the bar, we were to have a comprehensive bill that creates that entire circuit board that's required for social determinants. That's the screening at an individual patient level. That's community care teams addressing frequent users of emergency departments, all the way to social impact investing and everything in between. That, to me, if we had a what's the word I'm looking for, but I guess the golden, sort of approach to all of this, what would that look like? And that we should be producing that as for anyone who's serious about this. It takes a comprehensive approach, and it takes time. So my last comment really is that there is some risk, right? Already the reports coming out that we're doing this work and it's not producing the kind of savings that everyone wants in the short run. Well, you need that entire circuit, you need time. And we're talking about inverting investments that have taken us decades to get here that we're trying to flip, right? So, but I'll stop there and would love to hear comments about that. My concern.
Yeah, Brian, thank you for that comment. You've warmed my heart that you know the Raising the Bar framework, because a lot of people put in a lot of effort into that. And so I'm really glad that you were already familiar with it. And I agree with you that that's what we need. I think you're right that the approaches in Congress, a lot of them are really piecemeal. You know, folks get interested in one little facet of the problems we have to tackle. And so none of those, even if all of those passed, that's not going to solve our problems. It's good. I think it's an encouraging sign that members of Congress are thinking about it and that their awareness is raised. But I agree with you that none of those alone is going to address this. I think, I haven't thought about sort of what is the exact way that you could get to that systemic solution. I think the thing that comes to mind that we have advocated for in NASDO over many years is really thinking about, flexibilities and ways to make it more simple to pull together the different sources of funding that exist. Because being realistic, we're probably not going to get a giant influx of new money. So we can't sort of create out of whole cloth a brand new program to do all of this. And yet there's lots of money available in systems now, some of it being used inefficiently. In theory, you can braid and blend programs, but it's really hard to do in practice. And so, I think the place where we've seen the most flexibility is in Medicaid, where, CMS can say to a state, here's your pot of money to work with. And I find it encouraging that the more recent waivers, we've seen some infrastructure included as part of that, which I think is critical, because we're not going to be able to do all the things we need to do if we're only able to fund, services to individuals and none of the infrastructure needed to make sure that those services exist. And we hear really loudly and repeatedly from our community-based organization partners in NASDO that they're very under-resourced, and they can't just sort of take an influx of referrals from healthcare and deal with those with what they currently have. So I think, to get to a solution, I don't have the magic answer, but it's going to take creativity of sort of repurposing what we have, but making that much, much, much easier to do than it is today. Because right now you can almost end up with more difficulty in reporting when you're trying to combine sources of funds than if you just use them separately. And that doesn't really accomplish what we need to. But I think you're asking exactly the right question. And I share your interest in an answer to it.
Sarah,
Yeah, go ahead. Sorry. Go ahead, Edna.
no, I didn't know she was taking any more questions.
Absolutely.
2 questions. based out of Dallas, Texas. So obviously we are our Texas legislature is skews conservative and Republican. And I wanted to ask you regarding the messaging, which we already have seen that here in Texas. Remind me again the two terms that the Republicans use to discuss social determinants of health. And then the second question that I have regarding your mention about the Medicaid and the waivers, specifically the Medicaid 1115 waivers. For us, what was interesting in this last session, which is still ongoing with special sessions, one of our Republican legislators had a Medicaid waiver relating to a pilot project to provide medical nutrition assistance. So it's kind of like a healthy food prescription program being used as a framework. So I wanted to get your thoughts geared towards Medicaid 1115 waivers that would appeal to Republican legislatures.
Got it. Okay. And you said you're in Dallas. Which hospital system are you?
With Parkland Health.
Okay, got it.
Parkland. Definitely, I definitely want to get your thoughts on the messaging because that would be helpful for us, and also just your thoughts on the 1115 side.
Yeah. So on your first question about messaging, so actually one of our members is the Episcopal Health Foundation in Houston, and they have been very helpful in telling us, for the reasons that you said, given the political makeup in Texas, what has resonated there. So there, the term that's being used is non-medical drivers of health, NMDOH. And then the term that is also used is health-related social need. And you actually see HRSN from CMS a lot. And I think that helps them stay close to the statutory requirements of Medicaid. And they did a state Medicaid director letter the very, very end of the Trump administration, like in the last week. And it was laying out all of the different authorities available to states to address health-related social needs. And the whole sort of preamble of the letter talks about how it's consistent with the mission and the statutory purpose of Medicaid to address health-related social needs, because that is addressing the health of the population. So I think that to me, it has a neatness because it ties to statutory definitions, and their argument was sort of like, this has always been related, and we're just making it really clear that it is related now. So that's that. And then to your question about 1115 waivers, I think, as I was mentioning, the food as medicine programs, which there's a lot within food as medicine, prescription produce, different kinds of food assistance, prepared meals for people with multiple chronic illnesses. Sometimes it branches out into the NIH definition in that COMPASS program, or no, they did a request for information on food as medicine, and they even included things like healthy cooking classes. Most people, I think, don't consider that food as medicine, but they took a very expansive definition of it. That does seem to have appeal, and I think part of it is because the direct link between nutritional issues and health can be clearer in some cases for conditions like diabetes and heart disease and high blood pressure, where you really can see actually a physiological impact of a change in diet on someone's condition. So I think, in the scale of what there is interest in supporting, I would say on the sort of easiest end where you get the least pushback is transportation, medical related transportation, get me to the doctor's office. Probably a little bit harder, but related to that is non-medical transportation, but that helps people, get to the grocery store or whatever. And then I think that the food related programs are often like that because they're, limited duration, and it doesn't involve the level of intensity as, for example, a housing intervention, where people rightfully ask questions like, should someone's housing be tied to their source of insurance? What if that changes? We know people do change insurance often. Then what happens to them? So that makes some folks sort of nervous. Whereas I think I'm not surprised when you said that you're seeing it in your state. I think it's an area that folks feel a bit more comfortable with. So I'm not sure if I was answering your exact question on that one. If not, feel free to follow up.
That's helpful because I think, like I said, it piqued my interest, and it caught my interest just because of the state and the dynamics that we work in. So for us, it's always a matter of what can be accomplished knowing the reality of the situation. So that's why I wanted to get your thoughts, especially since you're seeing at a national scope level. What other things have you seen that piqued the interest of Republican legislators that appeal to them under that umbrella of, like you said, in Texas, we are using the non-medical drivers of health?
I'll say we're seeing waivers from red and blue states. It's not like it's only blue states that are doing waivers. I will say, if you ask me to draw a trend line, the more expansive waivers, like the Cal-AIM waiver in California, a huge population is eligible for it. Oklahoma had a waiver recently, and they had a much more narrow definition, a particularly high risk, high medical cost population, at risk of homelessness and, chronic conditions. I can't remember their exact definition. That one you're probably more likely to be able to see actual cost savings in the short term. The issue that you raised, somebody before, I think Brian raised this, that, I'm very cautious. I really try to catch my language when I talk about SDOH and talk about the value of those services, not the ROI. Because I'm skeptical that we're going to see an actual return on investment unless it's extremely targeted. In the course of, providing assistance to someone during the course of a pregnancy where there is like a baby born either healthy or, preterm and NICU expenses, you can, maybe see the value you got in actual as a return. In many other cases, I think the value is something more, and that's not the standard we hold everything else to. So I think we need to be careful about what we're expecting out of the investments we're making in health related social needs and the upstream drivers of health. I think there's value to it, even if there's not a return on investment.
Does anybody else have any questions they want to direct towards Sarah? If not, I had one question, and it's a little bit, it's not that, because there's still time, but how vulnerable do you see this type of legislation related to social determinants of health from just normal political cycles? Do you think it's basically here to stay with us? And like you said, there's broad support in some ways, and to Brian's comment, it will just sort of be hodgepodge? Or do you see it as a larger movement that will also be bipartisan? So I'll let you speak to that.
I'd say that in my view, it's good news that the administration, regardless of political party, has a lot of room to be operating kind of within current statute. So we're not super dependent on Congress being able to take action. In some ways, we've had discussions within NASDO about certain pieces of legislation where we're actually worried about unintended consequences of like, what happens if we try to define social determinants of health? That's actually could end up with causing us some limitations. And there are a few hot button areas where some people might consider something a social determinant of health that other people, don't view as appropriate for being in that category. So there is some risk of harm, honestly, in legislating when you already have broad authorities. I've come from working in Congress and working in administration. And, from when you're in Congress, you want Congress to define all of the ways the administration can do things, but it's just not realistic. It's really hard to change statutes. It doesn't happen very often. And so it's, good policy making to leave some discretion to the administration. There's some risk there. So, I don't think it's going to go away anytime soon, that people are interested in health related social needs and in the underlying drivers of SDOH. How much they think that the health system should sort of bear that, though, I think is kind of a question. And I'm imagining for HON members, it's what you're facing. It's like, is this a must have or is this a nice to have in an environment where we're facing budget pressures? Is this what has to go because this isn't the work that is critical to healthcare? I would argue that it is critical to healthcare, but I think that it is easy to say, no, this is nice, but it's not necessary, or this is not hospitals or insurers' roles to be doing this. Let's leave it to somebody else. So I think there is some risk, but the way that we're set up today, I think is fortunate in this situation for what I hope can get done.
Thank you, Sarah. I think BitCom wanted to jump in as well to talk about how we're going to be collaborating with NASDA in the future.
Yeah, just thanks, Sarah, and for what Brian mentioned, that we have been working with you over the last year and have been holding these quarterly calls with you more recently, and just appreciate your time. And we, when you joined us last year, we encouraged our HUD members to sign up for your newsletter on your email list on your website to stay in touch just more directly. We see you as being the lead, your organization as being the lead in this area. It's expertise that we don't have, so just really appreciate it.
Well, thank you. And I appreciate the partnership with all of you. As I mentioned, when we were doing our Raising the Bar work, we looked at so many of your different institutions, and they're featured there in our report talking about bright spots in the health system. So we're grateful for all of what your members individually do, and for Han for being the sort of collection point for the work and the sector as a whole.
Excellent. Do I see anything in the okay. Brian shared another observation in the chat for those following at home. Thank you, Sarah, for your presentation. It was, as always, extremely informative, and I think it give us a lot to chew on in the next few months, and to figure out our own priorities, whether we're health system or we're helping health systems realize their anchor mission. I'm going to move on to the last part of our trying to find my screen here. I know I have it. No, give me 1 second here while I find. We have just a few announcements. Okay.
You want me to share my screen, Sandra?
I am almost there, I think.
Okay.
Did I get it?
Yeah, you
No.
did.
Okay, great. Too many screens. Too many screens. Okay, so the last one of the last couple of announcements we have is that the Han orientation call, our next orientation call, is on December 11th at 2 p.m. Eastern. This orientation gives new members or new staffers in your organizations a chance to understand the Han systems and our initiative groups in the hiring, purchasing, place-based investment, advancing your anchor mission. We have one on collaborating with community. We have this one, of course, AAP. So if you know of anybody in your institution who might be interested, please drop your email in the chat, and we'll reach out to you, and so that we can send them a calendar invite. Okay. And the next, we also have another, the 2024 edition of the Real series, that for folks who are not familiar with it, it's a leadership, it helps leadership, healthcare leaders cultivate their leadership capacities to advance racial and economic health equity within their organizations and society at large. And there's a link there in the QR code if you want to learn more about it or access the application process. Again, if you need any assistance with that, please drop your name in the chat and we will reach out to you. And I would be remiss, we just did this last month, but we're already gearing up to do it again. It's our 2024 convening, which will take place in St. Louis. And that you have the dates so you can mark your calendar. I'm sure we will also be sending out calendar holds, maybe not this month, but in a couple of months. But if you are thinking you're going to join us, please take advantage and jot down these dates. Yeah, that's it for that. And next steps. So if you leave with anything today, I hope you will leave with wanting to contact your members of Congress to put pressure on them for, in particular, the AHCIA and HOME, and possibly the Jobs Act. We will be sending out to you email templates about for outreach for AHCIA. The action campaign has made templates that are specific to party and whether it's Senate or House. So we will get those out to you shortly, so you can just dash off a little reminder to keep those in mind for year-end tax bills. Okay. And with that, I think we covered everything. If anybody has any questions about anything we covered today, we're happy to stay on. If not, we're gonna let you get on with your day.